in early November. Give you my thoughts on that coming up in just a bit.
Oh, hoping and crossing our fingers for that one. Thanks, Chris. Okay, we do have a few more days left in the month of October, which we all know it's Breast Cancer Awareness Month. Those going through treatments for the disease face many side effects too. Debra Reis is a registered nurse at the Promedica Cancer Institute, a facility which helps with the stress of cancer. As I can imagine, Deb, a lot of stress goes with this. It's not just you go through treatment and you're done. It's a lifelong stress that a lot of people have. So, Deb, let's talk about how this program was first created with Promedica and where the need came from. Go ahead.
Well, it was recognized several years ago that complementary therapies are really integral and part of a patient's plan and in moving through the cancer experience. And it is something that it's complement the treatments that they're going through.
Okay, so definitely something that adds and uses your own body or uses natural oils and things like that. More of a holistic approach after you're putting your body through a lot. These cancer treatments are not an easy route for people to take, but it's necessary, unfortunately.
That's correct.
So, Deb, how did you first find it in yourself to get involved with this route of nursing? Obviously, a little different than what a lot of people would do. So where did this come from for you?
Well, it really was more of a personal journey for me, and that, you know, as a nurse, I've started to explore different modalities and looking at what I looked at as the art of nursing and looking at those types of modalities, therapies that not only I can use personally, but I found that were very helpful for patients as well.
And Deb, especially this day and age, people are turning more towards that natural route, that holistic route, whether it be for depression, whether it be for cancer treatments now. So it's kind of neat to see the different options that are out there, that you don't just have to go one route and that's it. So talk about the different opportunities that are available. I know these are classes that people can sign up for.
Right. So we do have various classes. We have classes on movement therapies like yoga and fitness movements
so
like
important.
Nia. Yes, and then we do have classes on aromatherapy, and then we do individual sessions. So a lot of times we want to focus on what is that specific goal or concern that you have, and we can do things like guided imagery or energy work, energy therapy, and really tune into that for them.
Yeah, we were talking a little bit before the break about really being in tune with your body and listening to your body. That's something a lot of people, they're just too busy or too stressed, and sometimes we take it for granted. So let's talk a little bit. I can smell your lavender oil over there, instantly relaxing you just to smell that. So talk about your involvement with essential oils and stuff too, and kind of praise them a little bit.
Right. Essential oils, of course, are natural from plants, and it is something that we find can be very helpful for relaxation. And so, and some of the symptoms sometimes people experience going through treatment, like insomnia, fatigue. So we can not only use the therapies that I talked about, but using the essential oils in combination can be really very helpful.
Yeah, it's an essential part of it. Okay, so we're going to do a little breathing exercise here first, because you know, our jobs aren't always that easy either. You got some stress in everything that we do. So what are we going to do here, Deb? What's one of the easy exercises?
This is a this is where I usually begin with people in doing a breathing exercise. And so I'm going to invite you to just close your eyes or just soften them and bring your awareness to your breath. And breathing in through your nose to a count of 3, and breathing out through your mouth to the same count. Keep your lips parted as you breathe in, and as you breathe out, parting your lips relaxes your jaw. Yep, I know.
Okay, well, if you don't want to go to sleep, but you want some of this help here, they do have these courses. So, Deb, how do people need to sign up?
Well, they can call the Hickman Cancer Center at Flower, and they can, we'll give them information about signing up for classes.
Oh, that's fabulous. And you do need to be part of the Promedica care system, too. So hopefully you're a patient there, and if you're not, you can jump on board. Right? Deb, thanks so much for everything you're doing and for a little more insight there on how we can heal ourselves. We appreciate your time this morning. There's much more WTOL 11 your day. I'm so relaxed.